Good morning. Welcome to Soulbirth here on Edge Radio Australia. An absolute pleasure to be here. I've just checked the old time here. We're even on time. We're running beautifully.
How's that?
Check it out there. The numbers are all lighting up. The screen's off. The screen's just off screen. They're all lighting up, doing all the right thing. Now, the person I'm talking to is, of course, the lovely face Suzanne.
Thank you.
Our expert in all things soul and birth, or soul birth as we join them together.
Yeah, absolutely. Hello.
Hello.
Good to see you again.
It has been a bit of a break for us.
It has.
I don't know, these people off having gallivanting, having holidays and stuff and enjoying life. What a great way to do things,
I had a lovely a week at the beach. It was very nice.
A week at the beach?
Yeah, wasn't that
nice? Okay, very, very cool. Yes. Up north, down south?
Up north in the beautiful weather. Beautiful WA weather, beautiful, perfect beach weather. So it was lovely.
Nice way to recharge and get yourself.
Oh, absolutely.
Yeah. In the meantime, I went south, but there you go. Not quite as long. I was gone for about 48 hours, but that was, for me, that was.
For you, that's huge. Missing in action, off-grid.
Off-grid.
Well done, you.
It's so good for the soul.
It is. Yeah, so really we're coming back really recharged then, aren't we?
We are. Big sort of day here at Edge. Lots going on and off camera and all that sort of thing. So, but I did notice something on camera, which is a little bit unusual. Okay, you brought a friend. You have brought a friend.
I brought my dear friend, my baby again.
Your baby.
Yeah, because I thought baby might be able to help us today.
Well,
subject.
Well, we do talk about birth and kind of babies are semi-involved in this. Yeah,
very well.
You've also got, I see, a part of a woman's body as well. There we go.
Always bring my pelvis too.
Always have one.
Don't want to go anywhere without my pelvis.
That's right. Thank you, Elvis. I really appreciate it. So what is today's show all about?
Well, after this lovely breakaway and getting ourselves aligned and back in tune, well, I thought it was a good time to be talking about, getting our body into alignment, especially when related to pregnancy and birth.
Okay.
Because it's really, really important. Did you know that, to have your body in alignment?
Well, okay. Define alignment for me.
Okay, so it's about, having so mainly is around our pelvis, and our spine, because if they're out of alignment at all our organs are actually skew in our body, and so they're not lined up. They don't function properly.
Right. Now, I had a little experience with this lately. I mean, I've actually thought to myself, I don't think my organs have ever been where they need to be. I think they've had a bit of a shove, a bit of push, whatever.
Oh, yeah, with all your...
Yeah, maybe. A bit of lifestyle involved there.
Yep.
But I was speaking to a young lady who actually was having issues with endo, big dramas. And she was explaining that, that the stuff actually moves your organs around and actually pushes them where they're not supposed to be. And the doctors have to
so there's many different things that can actually cause, misalignment of all your different organs and your spine and what have you. So, whether it be from, activities that we do, like getting bumped and pushed around, even the very act of birth, it can actually put our spine out, which is what I want to talk about today as well, when I'll get to that.
Yep.
But, as a baby comes through the pelvis, it actually, twists and turns and what have you, and just the process of birthing can put the spine out of alignment. And so I'm a big advocate of, having the spine adjusted after the birth, just to put everything back into alignment straight after.
I have never thought about that, not even once, the fact of realigning the old spine afterwards. What a great point. So after, do you prefer, everyone's got a preference.
Yeah, there's so many different ways of doing that. So, and, we'll cover a few of those because there's, and I learned most of this through being a parent myself, because I had my first child ended up with severe colic afterwards. I didn't know about any of this before I had him.
It's a bit of a challenge.
So, you learn by doing and being in that. So, being a parent, and you have these different challenges, and then you seek advice and find out solutions. And what worked for him was to have a chiropractic adjustment, which I didn't know about until months later when he was 4 months old or something. Okay. And a friend of mine, her husband was a chiropractor, and he specialised in babies. And so, he adjusted him and the colic stopped immediately.
Imagine if more people knew about that sort of thing, because, colic can be so debilitating for a baby. And let's face it, the honest truth is, for mum and dad, not a lot of sleep.
No,
it is a really, really, really tough time. So if you can take that pain, that discomfort away from the child, you're also improving your own life. I
know. It made a big difference to me, not only for my baby, because he got to sleep better and, he's not having all these throwing up all the time and tummy aches, because projectile vomiting as well, which is not to do with colic, it's something completely different. But that's another issue that newborn babies can have with projectile vomiting.
Oh, and I have a particularly weak stomach, not going to lie, okay? When it comes to these things, okay, parenthood made me up my game quite considerably.
And did it?
Oh, yeah. Because, let's face it, babies make mess out of each end.
Yeah, they do,
and even ends that
indeed.
you didn't even realise, that they can make mess from, and they can do some things which are highly questionable. And I learnt to be able to dry reach and clean at the same time. So, yeah.
It's a very special gift, isn't it?
Well, you've got no choice.
No, that's right.
Yeah,
Isn't parenthood wonderful?
That's right.
So I'm sure anybody out there who's a parent would totally get this.
It's so true, so true. And I mean, I could go through. I mean, your projectile vomiting is a real thing.
It is. It is. I know.
I don't think I know a single child who hasn't done it.
Oh.
And I mean, apart from the fact that you feel like you're living like a scene through The Exorcist, right? There's that massive clean-up aisle floor afterwards, right? You've got to deal with it.
It's not nice, especially when you cop it full frontal. It's not pleasant. But anyway, we'll spare the viewers. We won't go into the details on that one, you reckon? Yes. Okay. But the thing is that, that's usually a problem because something's out of alignment.
Mm-hmm.
Quite often the spine is out of alignment, so it might be pinching nerves or actually, it usually impinges on the neurological development of the baby,
Gotcha.
and, which then affects all the organs as well that those nerves supply.
Yep.
So it can be the stomach, so the sphincter, which is why the projectile vomiting or the colic, So once we relieve that pressure, we put everything back into alignment, it helps the neurological development.
That's interesting. It's never been something I've ever considered. You just kind of think it's been, it's part of parental life, okay? Dealing with
it doesn't have to be.
Moments.
It doesn't have to be, though.
Wow.
That's the thing. So if you're actually aware of it, which, this is the idea of this, isn't it, to share this knowledge, because if you're aware of that, there's so much that you can do. And, you might not be somebody that resonates with chiropractors because there's all different kinds of therapies and practitioners. But, I chose chiropractors because that's what my friend introduced me to.
Of course.
And since then I've sworn by chiropractors. But you need to find one that actually works with newborn babies, that, is competent with babies.
Very, very true.
Yeah.
And I want to bring up Bowen as well on that.
So that's the next one I was going to talk about.
There you go.
There
I'm
you
ahead
go.
of you.
See? Oh, my gosh, he's thinking he can read my mind. This is really getting bad. We can read each other's minds.
It's terribly dicey, I'll tell you right now.
Dangerous territory.
Well, okay, now that I've read your mind,
and
it's a terrifying place to be, trust me. No, but honestly, I'm a big fan of chiropractics, okay? And I'm new to the world of Bowen, and everything I'm hearing is very, very positive. I don't think I've heard a single negative thing, to be frank.
No,
which is great.
No.
What a good indication that is.
I know.
So
but Bowen is really great too, because Bowen is very gentle, so it's not much manipulating.
Sure.
And with chiropractics, I've got to explain too to people that when it's working with a baby, they're not cracking spines and doing all the cracking their head and everything. They work using a lot of kinesiology based techniques,
right.
So it's very gentle, and also the activator, which is a little clicky thing that you use, and it's gentle. It just does a little click on your spine, on your neck or whatever, but it's very quick and easy, and it's painless. The
activator doesn't, it's very low impact.
Very low impact. So it doesn't, and it's only a very quick sort of thing. And once you put the baby's spine back into alignment after the birth, even after a normal natural birth, just the process of, you can just think, coming down through the pelvis, and the head has got to come down, and the baby's got to wiggle around, and quite often, which is a terrible practice, they're pulling the baby out, especially if they've had an instrumental birth, which is using forceps or a vacuum.
Mm-hmm.
They're actually applying something to the baby's head and pulling the baby out. So this is a bit hard to pull out because it's there's no slippery amniotic fluid or anything.
No.
But when a baby comes out, they're doing a lot of maneuvering, and there's a lot of traction on the baby's head and neck.
This is such common sense stuff, but you just don't think about it.
No, but this is the thing, when you see the mechanics of birth and how that works, is why I brought the doll and pelvis in.
Good.
And so those who can't see, if you're just listening to this, hopefully you can visualize what I'm saying.
Yeah, well, catch us on YouTube. Go to Edge Radio Australia on YouTube. Have a look at all of your fantastic videos there.
Yeah, exactly.
Because there is so much really good information, and that is a visual that. Now I'm looking at it, it just makes I had never thought about the chiropractic sense from the pinching of nerves, all those sort of goodies. That makes a lot of sense, especially if there's forceps involved.
I know, especially for the baby, like you're just imagining, and especially because quite a common birth practice is that as the baby's coming out, because it does this thing called restitution, where the head, when it comes out straight, then it turns around to the side, and then it allows the shoulder to come through.
Right.
And then the arm will pop out. But, this is a point where quite often they're trying to rush it, and they'll put downward pressure on the head so that the shoulder pops out and the arm will come out. But you don't need to do that. You can just let the baby come out in its own time, but this is a common practice. And then they'll put upward, pulling on the baby's head to pull it the other way and get the shoulder out. So can you imagine what damage it might be doing on the little nerves in the neck
100%.
and the shoulders?
I'm sitting here with a bit of I don't know what's the look I've got, but
shock and
horror and pain.
I know.
Like, that looks really painful.
It is.
And for a little baby.
I know. And yet, it's always kind of pushed aside because, there's not enough awareness about what a baby endures during the birth. It's just like a baby. It's not
like you can ask them.
No, and a baby cries after birth, but they want, the old-fashioned thing is they used to hang the baby up by the feet and slap its bum and make it cry so that it took a breath. And, what a horrible way to come into the world, being spanked as soon as you come in. Thankfully, we don't do that anymore. However, the fact that, when a baby comes out, it probably is crying probably because of all the pain, the tension that's been put on it. Because if you have a beautiful, peaceful water birth and the baby just comes up to the surface and takes a very gentle breath, they quite often don't even cry. They don't need to cry. They can just take a very gentle breath, just like that, and then their lungs will expand and they'll start to breathe. They don't need to cry. So, it's an indication if a baby comes out screaming, it's like, what's been happening in the birth process? How much pain are they in from the pinched nerves?
Think of the trauma of that for the baby.
Exactly.
Literally simple as that.
Exactly.
That is really, really surprising. It's things. I mean, I remember hearing the stories, holding the baby and the slap on the bum and all of that, and it all seems a bit rough. But okay, I'm kind of thinking of this is like 8 hours of bungee jumping, right? Okay, of your spine and being that pulling feeling that you get from that.
Exactly.
Not a feeling everyone will know. I know, but but that, I suppose we all do know it. We've all had it in one way or other.
We've all been born, but you're probably not aware of because you don't remember your birth. It's probably nature's way of, wiping out the trauma. But, quite often people that have done, life regression or hypnosis and go back to the birth, there's a lot of stuff that has been revealed, about what actually was experienced from the baby's perspective at the birth. And so there is a lot of trauma that we carry that we're not even aware of because it's just stored in the subconscious mind. And then when we delve into it in a session, because like when you're 30, 40 years old, you've got this unresolved trauma for something, and then you go into a session and go back to birth, and it turns out that there's trauma that you've got there from birth, whether it be physical trauma or some other kind of trauma.
I don't want to take this too far off track here because, I do go.
Why not? We always do that.
Okay. But, okay. I used to think, and there was the joke of the Freudian thing of laying back on, talking to the psychologist or psychiatrist, you laying on the leather couch and tell us about your childhood, right? And I used to think, roll the eyes and think, yeah, whatever, okay, that your experience is, you're not shaped that way. Now, through life and through experience and actually opening my eyes to things and opening my heart to things, I guess, probably even opening my soul to things that I deliberately shut off. Everything in your life, every decision you make, right? The person you are, the ethics you have, the direction you decide to go, and the people that you surround yourself with, all has to do with childhood.
Oh, absolutely.
We're all so why not go back to the beginning?
Absolutely,
right? And actually realize that maybe you didn't come in like the best possible way.
Exactly, and I mean it doesn't start at birth either. It starts off back in the womb or even preconception.
Sure,
because when we're talking about this body alignment, I even take it back to preconception. So so for fertility, for those couples that are having issues with fertility, it's a good idea to get your spine aligned. Whether it's with a chiropractor or an osteopath or a bone therapist, whatever is the one that resonates with you, to go and make sure that your spine is in alignment and your pelvis before you actually work down the conception trial, because that helps to put all your body organs into alignment. It helps with the reproductive health and fertility. It helps with the neurological, so making sure that your nerves are all in alignment so that all the organs of your body are actually getting well nourished with nutrition and oxygen and what have you. So, and all the organs are actually in place where they should be. So if the uterus is off alignment, like if it's leaning back or forward, you may have more trouble conceiving. Whereas if everything's in alignment, then you're more likely to conceive easily. As well.
100%. It makes so much sense. I'm sitting here right now, and I'll have a little confession to you, right? My neck is killing me and my back is killing me, right? Lots and lots. And I'm literally struggling to move my head comfortably, right? Now, how that affects my mood and how I get through my day and the start of my day and all of that, right, has, like it colours and shapes my day and my week and whatever, right?
Yep.
So, I need to go and see the chiro. There's as simple as that. Or have some Bowen. Or
Bowen. Somebody who's a Bowen therapist, and, you could go and get a Bowen
I know a couple,
treatment.
so I need to get onto that for sure.
Exactly.
I do keep doing the naughty thing. I'm just too busy. I'm too busy.
Exactly. We always put it off, but then we always whinge about our pain and the fact that we're, immobilised and stuff. So,
so true.
But how much longer can you put off your health and well-being? Because it does impact you.
Of course.
So,
and I'm not living in negativity, but like, okay, in pain is negativity to such a big extent.
Well, it affects our mood, doesn't it?
Of course it does.
When you're in pain, it really affects your mood. So you get really crotchety and short-tempered.
So if you want to have a baby and you try to get everything aligned, okay, well, it's common sense to me. Like, okay, go and make sure your body is, you can't all make sure everything's in the best kind of nick, but the things you have got control of, you can go and have some spine work. You can have some Bowen. You can have some chiro. You can have, whatever happens, whatever, your modality that, of choice, I guess.
Yes, exactly.
Right? Get it done because, and I would be, I'm certainly no expert, but I would tend to think that the better you're feeling about yourself and the better you wake up in the morning, the more chance you have of like falling pregnant.
Yeah, absolutely, because it does affect your mood. So, elevates your mood, elevates your vibrational frequency. So if you're wanting to have a conscious conception, all those things, and then this, aligning all your organs.
That's right. And for the fellas, right, if she's complaining about a headache.
Exactly. So,
winner,
get the alignment done.
Yeah. That's it. Well, okay, that's something so basic. I can't believe that it never even occurred to me. And then funny enough, just having that visual of you pulling the baby through that woman's pelvis, because only women have those pelvises, just so you know. Only the genuine OG women, not these, others.
Again, can you remember why what's the difference between a male and a female pelvis?
There's the back bit, the little
front bit.
No, front bit. Sorry, that one opens, right?
Well, the symphysis pubis has cartilage there, not bone. It's not fused, so that it can soften and open during childbirth.
Oh, see, I got it wrong already. I was thinking about I did think about the fact that it was soft, but I was thinking that bit was more flexible
coccyx.
too.
Well, everybody's coccyx is flexible, but this has got a reason for women in childbirth because it actually flips back up. It's a movable joint, so this same thing. It's got cartilage in there in the sacrum, in the coccyx, between the sacrum and the coccyx, so that it can flip up. If you allow it, if you're not sitting on it or laying on it, if you're in a position that allows movement, then your coccyx or tailbone can flip up out of the way and increase the opening so the baby can come through. As long as you're not sitting on it. And again,
only real women, okay, legit women. OGs, they're the ones who can do that. So, I know I push this, but I think it's so important. I think there's so much, silliness going on in the world, and we should be celebrating our genders. Okay, we should be celebrating the fact that women have this incredible ability that you're bloody lucky. Okay.
Well, yeah. This is why we chose to come in as women.
Yeah.
Because we
tell you what, you won the lottery. As far as I'm concerned, women do. I really mean that. I mean the ability to bring life into the world is a look.
It's a gift.
It's a gift. It's a privilege that you can't believe.
It
and as a dad who feels incredibly connected to his kids, right? I never ever want to discount that, because believe me, men, we do feel incredibly linked to our children.
Yeah, absolutely.
But there's you're very lucky. I'm not jealousy as such, but
you have to come back as a woman next
I will,
time.
Next
Aaron.
time, okay. Add that to the list of things to do.
Jeez. But there are definite roles, and being a woman, I do feel is a blessing. Like, I am so grateful to be a woman, because it is a real gift to be able to bring life into the world. To actually carry life. So I always refer to the uterus as the Holy Grail, because it's actually what carries life, and we give birth to that is just a real blessing. And it's a shame that parenthood and mothering is not held up in more high regard, and actually held
See,
as
I
the
disagree
highest,
with that.
the highest calling.
I think this is, again, without it going down the rabbit hole, I think that the media and the machine tries to downplay it. I know in my life, I know that the women in my life and my friends and all of that, the women are put on a pedestal. We think, honestly,
that's great.
Very, very much.
So it depends on which areas you're in.
Yeah, exactly. And cultures are different. Some cultures don't do that.
I know.
No question about that. But certainly in Western culture, to a big extent, and maybe actually probably to the detriment of men, to be frank. Women are put on a pedestal. Most men treat their women like absolute princesses.
Oh, well, yeah,
certainly my
great.
experience.
Yeah. And I mean, there's all the equality, but what I'm thinking is, like, so many women are pressured to go back to work, and whereas to me, I mean, and it's a personal decision, but belief, but raising your children, like giving birth and raising your children, because they're the next generation, is such an important role. And if we can bring our children into the world in a beautiful, peaceful way, and then nurture them and raise them with love, then they're going to be beautiful humans in the world, and they'll grow up in peace and love. And imagine how that filters out into the world.
Oh, there is no more important job. Okay. I've had the pleasure and pain of being a stay-at-home dad and raising beautiful children and going through, and it's hard work, like it's challenging work.
It is.
But it's also it's the best job in the world, and
it's very rewarding.
100%. And I think that there's a saying out there that no one ever wished on their deathbed that they spent more time in the office.
No, that's right. But they do regret not spending more time with their kids.
Exactly.
Yeah.
So, cherish them, spend as much time with them as you possibly can, and you give them the best start you possibly can in your circumstances. Now, we live in a world right now where we're finding that, life is unbelievably expensive. People, couples, back in the day, you could afford to, have a house on one income and, have a good life that way.
Yeah. It can't now.
It's just not possible unless, that income happens to be, hundreds of thousands of dollars. So that, it's a sad reality, or I don't know, consequence of modern life. But there's alternatives to it. I mean, you could go and live in a country town where real estate's cheaper. You could, there's things you can do if you want to live that, that old traditional life.
Live off grid or but anyway, it's all personal choices, and it's all part of our soul's journey, isn't it? About the choices that we make, and how we raise our children and be in the world. So for sure. But so when it comes back to the alignment, it's about also with pregnancy being aligned as well, because if we keep our body in alignment in whatever way, then the baby can also develop in the womb in the most optimal position as well. So that, because if our uterus is out of alignment, so it's tilted one way, then as the baby's growing in the womb, it's tilting, and the weight will be going one way, and then it's harder and harder for it to be more in alignment. And then when it comes to giving birth, if the baby's not in optimal fetal position, as we call it, which is the baby head down, preferably curled up in a ball, bum up, head down, and all ready to go, preferably with a back to the front, so that it's in the easiest position to come through the pelvis. And then it's more likely to flow through and have a really beautiful birth, where it is a lot quicker and less painful. Because when things are out of alignment, we have, more pain or sensations of that, and also it can be a longer birth because it's harder for the baby to wind its way down through the pelvis and come on out.
You see, as a former rally driver, I like the idea of coming into the world sideways.
Of course.
Sliding sideways even better, right?
Wouldn't it be interesting to find out what position you were in the uterus?
I would be very interesting. I do know, like I've said this to you before, I mean, I was born blue. My mum was in the hospital 4 minutes when I was born.
Oh, wow.
Didn't even make it to the ward.
No, that's incredible.
So cool. I was happy with that.
You were just in a rush.
In a big hurry to be
here. You
here.
were born for rally car driving.
I reckon. And some other lifestyle choices. Oh dear.
All right.
But it is just an absolute miracle, and I think that like bringing the pelvis in is a really good idea because it shows so graphically.
Yeah, it does.
When we talk about alignment, it's a brilliant way of doing it.
Exactly. And because the other areas that can be out of alignment are our sacrum, because we've got, like I've said before, our joints here are called the sacroiliac joints. And they also have cartilage there. And so they're the parts that ache a lot when you're pregnant, and also during birth, because you've got all the hormones of birth or pregnancy softening it. And so there's a lot of movement there. Small movements, but you can feel them. You get a lot of backache, and especially if the baby's posterior, which means, when the head's against your back and they've got the hardest part of their head pressing against the sacrum. So the mum gets a lot more pain in the sacrum. So this is where it's good to have the adjustments, whether it's chiro, osteo, Bowen, or massage, heat treatment. You can put a hot
I was
pack
going to
on
ask you that. What are some other sort of techniques?
So massage is great, because especially, during birth, one of the best things a partner can do is actually massage on the sacrum and those sacroiliac joints, because they're the parts that are aching more. So quite often it's a flat hand there and just, rotating, like massaging on there, or it might be thumbs into the joints here and massaging there.
I was doing the 3 fingers sort of, like you sort of, it's not the most ideal situation. So you're trying to, you try not to be intrusive.
Yeah.
But I found the old just doing that kind of thing around that area was helpful.
And getting a bit of massage oil or something so that you're not going to chafe the skin, because all
I did
that rubbing.
Not think about. I wasn't that prepared. And I've done this more than once, let's face it. But that's really, I find that interesting because this is all education. Like what I did is because, my girl was in pain there, so I rubbed there, But I don't know, here's a little sideways thought. As a partner, wouldn't it be a nice idea to maybe go and do some sort of massage course or maybe get some sort of education in that department just to help through the process?
Exactly, or go to childbirth education classes that are, sometimes it depends on the classes, but sometimes in the hospital, depends who's running it. They might teach you those techniques about, where to massage and give nice comfort measures. Or, if you're going to external classes, like with a midwife or a doula or, somebody else who's running them, because I ran them for years and I'd be teaching all these different methods about how to, do all these different massage techniques and positioning techniques, and there's so many different things that you can do.
Certainly, again, me going from my experience, I wouldn't, I'm going to be very honest here, I wouldn't be getting my education from the hospital system. I really wouldn't. I'd be going and seeing a midwife out of the system, a doula out of the system, for all of these sorts of things. Because, I felt that certainly antenatal classes for me, and my wife were not the most positive experiences.
Yeah, right? And again, it depends on the place you go too, because there's so many different classes, and it quite often depends on the person running it,
Agreed.
And whether you resonate with that person. And, quite often too, the hospital classes are usually aimed at, what their procedures are in their hospital. And so the educators are, midwives that are going to be looking after you at the hospital, but you won't necessarily have them.
Of course.
So it's more about how they'll manage your labour and how, things that, you might expect. So it's usually more the medical kinds of pain relief, like, the drugs and the epidural and all those different things. So it depends, again, on the educator as to whether they teach you the natural methods of comfort measures.
Sure. I mean, I think you've nailed it. From my point, was very much that it's a hospital way. So they're looking at they're always talking about the medical procedures that we can use, the intervention that can go that way. They're also, and this is again my experience, it was very much like being in a school class, right? And you were naughty, and you can't say this and you can't do that and all kind of thing. And in that era, and I'm talking, it's a long time ago for me now. Not so much with my youngest ones, but certainly with my eldest son, it's the first time and the last time I did antenatal classes. It was very much for the man to, look, please get out of the way.
Oh, okay.
Right? Yeah. Wow. So, support your wife until she gets to that point where we'll take over, you step aside. And I don't think it was a great thing, and that's why I love what you do. I love hearing about the fact that you're there with the woman. You're actually giving her step-by-step care all the way through. But it's not just the woman; it's the baby.
It's a partner. It's the whole, it's a whole team. It's the triad. During birth, it's the mother, the partner, and the baby. They're all working in unison. So you got to honour that triad. And actually support all, because the number of times that the partner gets left in the background and kind of they're either fainting in the corner or they're feeling helpless, not knowing what to do. But if they're just guided as to some things that they can do, and massage is one of the things that they can be so helpful, and it saves the midwife's hands, because even though if you're a midwife, that's what you're doing. Or you can direct the partner to do it, because the woman quite often needs constant massage, because once she gets into established labour, then she's going to be needing it constantly, because that back really hurts, so it's very uncomfortable.
Again, this is another reason why, again, the work you do is so important, because I'm really thinking back now. I'm really pushing my memory, and I don't remember the midwife doing anything like that.
Oh, wow. Yeah.
Certainly on two of my children being born. It was very much this is a medical kind of procedure. And
and you've got to remember too, though, if you're birthing in the hospital, the midwives that are looking after you are generally looking after several women. They're not able to stay in the one room and look after the one woman constantly, which is why partners and support people are so important, as we've talked about in other episodes, because they need somebody who's there, continuity of care, which is why home birth midwives are great, because there's continuity of care, or midwifery group practice where you've got your one-to-one midwifery led care, because you've got them with you the whole time. Whereas when you're in the hospital system, you don't have that unless they're quiet, which is like, I can't remember when that last happened where it was quiet. So, and it's just getting worse. It's so busy. So the midwives unfortunately don't have time to stay in the room and do massage constantly. So they need a partner or support person that knows where to massage, in different forms of massage as well.
Yeah, maybe I'm being a bit harsh. I mean, maybe it was the fact that maybe because the midwives and that saw that I was, giving it a go and trying to help out and trying to do the massage. Maybe they thought, okay, they've obviously worked it out. I just love the more patient focused, child focused, those incredible elements that are so important. I think that has really rung true for me. So since you and I have been doing the show, I mean, I've learned so much more, because I used to see it very much as a medical procedure.
And that's how most people see it, unfortunately. And even in the system, it's kind of, if you've never worked as a midwife outside of the system, you can't, especially in a high risk setting, you can actually think that that's what birth is normally like. It's a medical emergency waiting to happen, because that's all you see day to day. Whereas if you're in a low risk setting or out in the community and that's all you see, then you know that birth is normal and natural, and the majority of births are normal and can be supported at home or in a low risk setting. And a woman doesn't have to rush. She doesn't have to be constantly looking at the clock. She doesn't have to be having all these other procedures or, epidurals and things, because, you allow your body to do what it needs to do by finding comfortable positions. It is. It's designed for birth. And if we look after our body and we keep it in alignment with all these, practices by going and seeing a practitioner, find one that you really like, that you resonate with, and have regular checks throughout pregnancy, so that because as your body grows and your baby grows, you're actually constantly changing, and all the hormones of pregnancy soften everything, so your pelvis is constantly shifting. So it's good to have regular checks.
This is sounding a lot like me after a weekend on the BS, but never mind. I don't know. Definitely getting larger, definitely softening, but never mind.
Jeez, we really need that, Bowen. Definitely where are you?
Definitely do. Oh, wow. Okay, when we're talking about home births and then the water birth, you can do obviously any combination thereof. Do people sometimes get Bowen or chiropractors or people like that, or massage people involved in that, therapists there?
Yeah, they can do. Well, yeah, they can do. But they're not normally at the birth. But you may have a friend who's your doula who actually does Bowen as well, or something like that, which would be really handy. But generally we don't. However, I remember my second birth was in Melbourne at a freestanding birth centre, and I had an independent midwife there. And it just happened that they also had a chiropractor that worked from the birth centre. And so I was seeing him throughout my pregnancy because I dislocated my tailbone with my first birth, and it was painful as anything for...
you couldn't shake your tail feather.
No, that's right. And after I had my son, because that was his birth, and when he had the colic and I finally got onto the chiropractor, he did such a good job with my son that then I got him to check my tailbone because it was so painful, and he managed to sort of get it comfortable enough so that I didn't have to sit on a cushion, ring cushion all the time. But when I was pregnant with the second one, everything started loosening up and the pain returned again. And so I started seeing a chiro that was attached to the birthing centre, and he was fantastic. And he just happened to wander into the birth centre when I was in labour. So he gave me a treatment there and then as I was giving birth, obviously before the baby came out, but when I was like wandering around beforehand. And then he just happened to be there like after, because I was only there for 6 hours after the birth before I went home. But he just happened to pop in that time and gave both myself and my baby an adjustment within 6 hours of birth, which was ideal. So I had a great recovery, and my baby never had any issues with colic or anything like that.
Okay. Well, I believe we might be having a guest next week.
We are.
They might just be related to this. Do you want to give us a little bit of a taster of what's going on?
Well, I've got a really dear friend, Amber Davies, who is a Bowen therapist, and she, we've been friends for many years, and she works a lot with pregnant women and babies with Bowen therapy during pregnancy and after the birth. So I've invited her to come in next week and share her expertise about Bowen, and how it can help through the process. So I'm looking forward to that.
Well, Bowen's quite gentle. Right?
It is. It's a lot more gentle than chiropractic. So even though chiropractic for babies and pregnancy is very gentle anyway, Bowen is more stretching and. Well, I'm going to leave that to Amber to share that, because I'm not the expert at Bowen at all.
Yeah,
but I know
stay in your lane now. Come on, really.
Absolutely. This is why we have guests come in, because she's going to share her expertise in that.
That's so good.
I have quite a few friends who are Bowen therapists, and they're all amazing people, and they can all.
I know a couple. They're pretty awesome people.
They are.
Yeah, it's and again, like I said before, I haven't heard a negative, not one single negative thing. You hear negative stuff about chiropractors, maybe from, like, let's be frank, there's good and bad in every profession.
Yeah.
And there's also different expectations. And sometimes people go in with very particular expectations. Like I don't like physio. Physio is no good for me, right?
Yeah.
That doesn't mean that I hate all physios and there's bad people who do bad work. You've got to find what works for you.
Absolutely.
And that does not work for me at all.
Yeah, and that's the thing, because there's so many different therapies out there, and we resonate with different ones. Because I wasn't really into chiropractic care because I'd had a bad experience earlier in life with a chiro that was very rough, and I just cracked my neck and I was didn't like that. But then when I found, when I came across this for my baby, and he was a fantastic chiropractor, and he completely changed my idea of chiropractors. And then when I, from there, when he was no longer around, or I moved house or something, and I found another chiro, but I had to shop around to find the right chiropractor. And but it's really particular, go by word of mouth and find one that's really good, that works with pregnant women and babies.
Agreed.
And also with osteopath. It's usually go by recommendations, and then Bowen therapy. Again, it's finding out who, and it's also the practitioner. Who do you gel with? It's the same with home birth midwives. You shop around and you find one that you actually gel with, because they're going to be with you right through the process.
Yeah, that's exactly right. Yeah, talk to different people in these professions. Talk to healthcare professionals who find the person, because, they might be very good at their job, but, you might not like their bedside manner, or you just don't gel with them on a personal level.
That's right. It's all just personal, isn't it? Connect with certain people, and you know who it is, who you resonate with, because if they're going to be your practitioner for life, which hopefully they will, if you find the right one, then you want to stick with them.
Yep.
And then you can go to them whenever you have issues of any kind, or even to prevent the issues from happening in the first place. And most of these therapies are really good for prevention rather than cure, as well.
And we're so bad. Well, I'm so bad on that. And I know a lot of people, we only go to see these professionals when we're in trouble, rather than do the preventative sort of medicine and avoid the pain in the first place.
Yeah, exactly.
Sometimes it's good to do a little maintenance on the way.
Yeah, especially if you've had a jolt or anything, if something's happened in life where you feel like you've jarred your spine, or something's happened and you're not quite feeling right, or if you're getting headaches, it's a good time to go and have a tune-up. Because you put your car in for regular tune-ups. Here we go. We're getting into the car. And
we always do. You did it this time?
I did. Oh, my gosh, I can't believe it. But we put our car in for tune-ups and services regularly. So why don't we do the same?
And we do it so it doesn't break.
Exactly.
Right?
Exactly.
So why in the world with our bodies do we wait till it breaks before we do any maintenance? It's ridiculous.
It is.
But we do it anyway. Because that's the just the human way. I'm sitting here, I'm thinking to myself, again, why I had a chiropractor for many, many years who I was, wrapped with. He was actually quite rough, which I didn't like, because look, I'm a big sook when it comes to these things. If I have a massage, I'm like, a little softer.
Oh, really?
Yeah. I'm one of those. But with chiropractics, I'm also I like the Reader's Digest version. I want it done. I want it done quick. I want my info quick. I don't want to have to wait. So I'm happy for them to go in there. And one that I used to use many, many years ago, it was a 3-day program. You go in there, boom, 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 3 days. Felt like crap on the 4th. Felt fantastic on the 5th, and you just felt so good after that.
Yeah, that's great.
Again, it's each their own.
Absolutely, yeah.
Whereas other people might need a more gentle, longer approach, where that might
Yeah, that's right. And because there's other therapies too, like, you know, there's acupuncture, like anybody who likes needles, acupuncture, so you like that. And so, you know, that is also good for aligning all your energies and your nerves and nerve pathways, the energy pathways. So, you know, that works really well. And reflexology, of course, because I love reflexology. I do it, and I love it because, you know, your whole body is in your feet. It was represented in your feet because it's the reflex points that correspond with different organs. So, and that's a really easy and relaxing way to get your body tuned up, and, you know, having a regular reflexology session, you know.
And again, finding a practitioner who really resonates and fits with you. You know, this is the thing, because it's just it's a relatively personal kind of experience, I guess.
It is.
When it's done right, and when you feel very comfortable, you're right. I mean, reflexology is one that I think so many of us just kind of forget.
Oh, yeah. Well, I love it because, like, when I have clients, you know, for reflexology, I love it because they can talk while you're doing it. So you can find out all the other stuff that's going on in their life as well, you know. And because you press certain areas on the feet and, like, they hit the roof all of a sudden because it's a point, you know, reflecting part in their body that's out of alignment. So it's like, okay, what's going on for you in that area? And it might be a physical thing, or it might be emotional, spiritual, whatever, but something connected to that point in their body is blocked or something. And so when you work on it, then it releases it, and then suddenly it's gone.
There's so many of these things, you know, it really is. And getting your head around being open to it is a big deal. You know, like I remember years ago when it came to acupuncture with me, you know, I thought, you know, how is he, you know, putting needles in? I can't even remember. I had needles in a part of my body that I do not even remember that relieved my back. And it wasn't my back.
Yeah, right.
Do you know what I mean? I was like, how does that? Yeah, whatever.
Yeah, well, that's because all your reflex points, like, you know, with your feet, your spine is actually represented down the inside of your foot there. That's all your spinal region. Then. Yeah, right. Yeah, and it's like in your thumbs as well. So when you hold your hands up like this, you've got your 10 meridians that run down through your body, and your thumb and your big toe line up, and your little toe and your little fingers line up. So you've got your 10 meridians, and then you've got all your reflex points within those meridians.
Gotcha.
So anything along there that you do will affect everything else in that meridian.
What a great way of looking after your child's health from being a baby to being a toddler to being a child to adolescence. Okay, to bring things like that into their life. How positive is that? Because that it normalizes it.
Yeah.
Do you know what I mean? It makes it part of their routine, and actually might make that person, well, not make is probably the wrong word, but encourages that person to care about their body in a preventative way and a maintenance way through their life, rather than the world we live in now. Yeah.
Exactly. And, you know, babies respond really well to touch. So baby massage is amazing too. And one week I'll get a baby masseuse on here too, somebody who teaches baby massage, because, you know, that's a beautiful, positive way that we can interact with our baby, because you just think, you know, it's all about touch. You know, when they're first born, you've got to have skin to skin, you know, because that's how they bond. That's how they pick up your scent and actually connect with you, and how they first attach to the breast.
And they're so soft.
They are. They're so beautiful, aren't they?
They're beautiful.
They love
being touched. They smell good, and
exactly.
There's so much, like holding a baby.
It's
just the best therapy.
I know. It's for both us and the baby, because the baby loves it because they're feeling loved and nurtured, and then also for us, we love it because it gets all our endorphins flowing and our oxytocin, our love hormones.
All our
feel
warm
good.
Fuzzy feelings.
Yeah, exactly, and they're really good, like on so many levels. So it's really good to do. And baby massage, you know, if we can get massaging our baby every day as part of their routine when after a bath, you know, holding their hands, rubbing their feet and legs, and doing little exercises that will help free up any wind that they might have in their tummy, you know, positioning, everything.
Well, let's face it, when you play with your baby's feet, right, like the old just rubbing the thumb there, and they giggle and they carry on and they're smiling, and it's a beautiful moment that they're obviously enjoying it. But you're also having that beautiful bond.
Exactly. And you're giving them a little mini reflexology treatment too. When you're rubbing in their palms of their hands and their feet, you're actually pressing on the reflex points. So you're actually helping to align their body and keep everything all flowing well, releasing all blocks and things. So you're actually doing multiple things all at once.
Go with the flow.
Absolutely.
There you go.
Oh, my gosh.
Well, we're going to go like the wind, unless you've got any last-minute things that you'd like to spring on me.
Well, spring on you.
Yeah, come on, spring away. Why not? Come on, let's do it.
I just wanted to remind people that, you know, tune in next week to listen to our session on Bowen therapy, because it will be fantastic. And Amber's a lovely lovely, gentle person, and
fantastic.
Look forward to hearing from her.
Yeah.
And also, if anybody wants to inquire further about, contacts for chiropractors, osteopaths, or any other practitioners to get in contact with me, or if you wanted to have a reflexology session, I'm always open to that. I do work from home and offer reflexology, and it's a great way to keep your body in balance and feeling good.
Look at that. And I, on a personal standpoint, would recommend this lovely lady so much. Honestly, the knowledge that she's imparted on me and the way that you've made me look at birth and, quite frankly, look, life differently. You've just got a wonderful way about you, a wonderful knowledge, and I would encourage anybody who's either having a baby or plans to have a baby or has got a baby, who has any whatever, to get in touch. And they can find you where?
Well, they can either call me on my phone number, which is on my website, soulbirth.com.au, or on Facebook. I'm also on Facebook as Faye Suzanne.
Faye Suzanne, look at that.
Or
Absolutely.
Soulbirth.
Or Soulbirth?
Or Soulbirth. I have a Soulbirth page too.
Which is one word. Don't do what I do and keep writing it as two. It is one word. All right.
Is.
Fantastic. Well, thank you very much for being part of Soulbirth here on Edge Radio Australia.
See you later.